Early in my career, I took care of a young man who changed my life. I got a call on a warm summer evening over the radio that EMS was coming in with a gunshot wound. I prepped the trauma room as I usually do, and then the ambulance came in. The man had been shot in the head. My team did everything they could, but we were unable to save him. And that was horrible, but honestly not particularly surprising. You see, we don't save a lot of gunshot wounds. What was memorable to me was how and why he died. He had shot himself with his father's gun. And seeing his dad at the bedside, that was something I will never forget. That case led me to start asking a bunch of hard questions. How did this boy get a hold of his dad's gun? Could we have changed that and saved his life? Why didn't I know that people kill themselves with guns? How many do that each year? And if this death was preventable, how about all the other gunshots that come through my ER? What are we as healthcare professionals doing about this? Now, I, like every other physician, nurse, and social worker across this country, have hundreds of stories of people we've cared for with gunshot wounds. Kids killed in tragic mistakes, young men caught in the crossfire, and people that are my own colleagues, like Dr. Tamara O'Neill, an emergency physician who was shot and killed by her fiancé as she was leaving her work in the ER last fall. Now, stories matter because they are memorable, because they motivate us, but stories alone are not enough. They matter when they're used to create change, to drive us towards truth. And that young man, he drove me to realize that much of what I thought I knew about gun violence was actually a myth, and he taught me to strive to do better. We as a country have spent far too long failing to make progress on gun violence. Depending on your perspective, you might think of this as being an issue of criminals, or laws, or mental health. But the truth is, although that's what the common discussion focuses on, gun violence is none of those. What it really is a public health epidemic. Now, what makes it an epidemic? According to the CDC, it's very clear. It's an epidemic because the numbers are increasing each year. Now, I'm a mom of two, and I'll be honest, every morning when I put my kids on that bus, I say a little prayer that today will not be the day that a gunman comes to their school. We all live in fear of mass shootings, and that's what most of us think of about epidemics. But in reality, over 100 people die and over 200 are injured every day across this country due to gunshots. And less than 1% of those are mass shootings. 2/3 of those deaths are suicides. And although mental health is obviously part of suicide, the truth is that mental health plays a minuscule role in our overall epidemic. Another thing that may surprise you about this epidemic, you might think of it as an urban problem. But the truth is, gun death rates are almost the same in urban and rural areas. In fact, the highest death rates are in states like Alaska, Alabama, Montana, Louisiana, and Missouri. Another thing about this epidemic, young minority men are disproportionately affected by gun violence. But the fact is, almost 2/3 of gun deaths in our country are actually white men, and veterans are at higher risk as well. This epidemic is everywhere. Chances are that almost all of you in the audience know someone who has been affected. And here's a really important fact. There are approximately 330 million guns in circulation in the United States. There were around 40,000 deaths last year. Now that is 40,000 deaths too many, but if you do some really simple arithmetic, you'll see that that means that almost all of the guns out there are not used to cause harm. And when we demonize guns or gun owners, we will not make progress. Here's a story. This is a colleague and friend of mine, Dr. Christopher Barsotti. He's an emergency physician like me. He's also a gun owner and a 4-H rifle safety instructor. He views gun ownership as a heritage, an honor, and a personal responsibility. He is also the founding CEO of Affirm Research, the country's only nonprofit dedicated to solving gun violence through the public health approach. He and I work together, not as gun owners or non-gun owners, but as people committed to finding truth and to putting real solutions in place that can make a difference for our communities across this country. And when we take this public health approach, when we approach gun violence as an epidemic, we can then create real solutions based on real facts. Now, I took care of that young man in my ER just after finishing many years of training as a medical doctor, public health professional, and researcher. I will not bore you with all the epidemiology and biostats, but suffice it to say that there is a 4-step approach that we have used over and over across history to solve public health epidemics. First, we count how many people are dying or getting hurt. Then we say what puts them at risk and why. Then we create solutions that work. And finally, we spread those solutions into communities across the country. When we take this approach, we succeed. And I'm going to share stories of 3 epidemics here: car crashes, HIV/AIDS, and gun violence. So on this graph, you'll see the yellow line is car crashes. Car crash deaths peaked in the late 1960s. We have now decreased car crash death rates by approximately 70%, not by taking cars off the road, right? There's actually more cars, more millions of miles driven than ever before. What we did was we used that 4-step public health approach. We discovered things like 3-point seat belts keep you safer than a lap belt. We created car seats and got parents to use them. We educated people about drunk driving. Another example is HIV/AIDS, the red line. Now, obviously, we discovered HIV in the 80s, and deaths quickly peaked. We've since decreased the death rate by almost 90%. Again, not by banning sex. We know that that doesn't work. Instead, we used science. We discovered the virus, created drugs, educated people about safe sex, and we reduced stigma to allow people to create opportunity and hope for change. Now compare that to firearms, the orange line. You all already know gun death rates are going up, and they've been going up inexorably since the early 2000s. Why? Well, not surprisingly, that's about the point when the so-called Dickey Amendment was passed, which effectively shut down federal funding for this public health approach to firearm injury. On this graph, the gray line shows that for most diseases and injuries, the amount of federal funding is basically proportional to the number of people who die. But gun violence falls off the curve. Overall federal funding for gun violence research is less than 2% of what would be predicted based on the number of people who die each year. Now imagine if I told you that we'd done virtually no research on cancer or heart disease or even car crashes since 1996. You'd be horrified. And then you wouldn't be surprised if I told you that death rates were going up. Well, same thing for gun violence. Now, I'm not naive, and if you'll excuse the pun, I know there's no magic bullet to fix this. Gun violence, like any other disease or injury, is complex and will require complex solutions. But using that 4-step public health approach will work, and it will allow us to take into consideration our unique American context. Now, when we take this public health approach, we create the possibility for change. I have spent the last 10 years since I took care of that young man, working with folks across this country, first doctors, then nurses, now the general public, to create a movement for change, for approaching this as a public health problem. When we do that, we create a potential to move beyond the old gun control versus gun rights debate and towards a new narrative of prevention, a place where we can put in place promising solutions like working with gun shops to promote safe storage, or training healthcare professionals to help their patients at risk, or talking about drunk shooting, which really is a thing. If we had had this approach in place 10 years ago, I might have saved that young man from ever coming into my emergency department. Could have saved the lives of those kids at Sandy Hook and Parkland, and the lives of the 100 people who died and 200 who were injured yesterday, and the 100 more who will die, and the 200 more who will be injured tomorrow. But I can't do this alone. My network can't do this alone. It takes all of us. And so I ask us to do 3 things. First, learn and share the facts. Things like what I said today. 2/3 of gun deaths in this country are suicide. There are modifiable risk factors, and the public health approach works. Second, share your stories. Join me and my colleagues in bringing this epidemic out of the shadows and into the light, where we have to talk about it and find real change. Feel free to contact me. Third, join us in taking action. Join us in this movement for talking about and changing gun violence as a public health problem. When we do that, we can create unity, we can create real solutions based on facts, stories, and evidence, and we can create hope for my kids and for yours. Thank you.